Now with Dr. Darien taking a look at a new study that suggests that reducing screen time could improve adolescent mental health. I'm not surprised with this one.
Not surprised, but also before we break into studies like this, we also have to make sure we understand that screens are everywhere. And so it can be incredibly difficult not only to manage our screen time as adults, but just trying to manage screen time for children. So in this study, they wanted to see what are the benefits or the effects of limiting screen time for kids. They had 90 families. They separated them into two groups, and in one group, they limited to 3 hours a week of screen time. And they found that in the group where they limited, they had improvements in emotional well-being, behavior, and social scores, things that you would expect. But just to take a step back, the average teen, adolescent child today spends about 8 hours a day on screens.
8 hours a day?
A day, and this is looking at
job.
3 hours a week. That is a job, and so this is looking at 3 hours a week, so very different things.
Yeah, but what do you do to curb that time? Because they are everywhere. How do you limit it?
Reducing screen time is always important. I think first off, calculating how much screen time you're using. Number one, looking at that number, and I think a realistic first attempt is trying to cut that number in half. Setting boundaries, setting up screen-free times for everyone, and we have to practice what we preach. We have to practice what we preach, and then making sure that we're trying our best. Deleting apps doesn't delete your account, and that can help you save time, making your phone less appealing. And I think one thing that's really important when I speak to pediatricians is don't make phones the reward or the punishment, because that can make it more important.